Sat Sri Akal, and welcome back to our 9:40 p.m. every Wednesday health show with Manjeet Kaur. Today, such an emotive topic we're talking about, and I have to congratulate Manjeet. More than 5 couples she's helped just recently, from the challenge of being infertile to having happy, healthy pregnancies. Huge congratulations there. I have to say, obviously, everything we're covering in this show is just a good discussion and hopefully valuable walk-away actionable points to take away in this second half. But do call for personal consultations. Manjeet, over 2 decades of experience, but let's come straight back onto it. And congratulations. I mean, the impact that you've had to those 5 couples. I remember when my wife and I, obviously we went through becoming pregnant with Harley. So talk us through that, because the impact to not only the parents but the wider families is huge.
It's huge. Obviously, one of the couples that came to me had already aborted twice in India. Mm-hmm. Not because of gender, but just because she was very early into a marriage. Little did her mother-in-law know. So when she came into UK and started residing in UK, she was failing to fall pregnant, and that's when they disclosed, both son and daughter-in-law, that they hadn't discussed with the family but aborted 2 fetuses in a short pregnancy of 8 weeks and 9 weeks. So she was ghastly shocked and emotional. So they rushed to me, and in 1.5 months, she was pregnant. So that was one of the cases. The most emotional case was where this female Asian woman was told critically that she could never carry a baby to full term because she had a chromosome that was very rare, but that would make her miscarry a child, which she had already miscarried, and already miscarried twins. And no hospital at 20 weeks was allowing those children to be taken into incubation across in Kent or away from Kent. Had she been in 21 weeks of pregnancy, they would have kept the babies in incubation for even up to 2 to 3 months. But when they're under a pound weight, that means under a kilogram of your sugar bag, because most of the weight, Felix, actually doubles after the 7th, 8th month. Mm-hmm. And the 9th month is when, if you're eating good food, then the baby's weight is going to increase. That's the muscles and the bones, everything is adding up. The bulk weight was the emotional journey. First getting her pregnant, which happened in under 2 months. I had told them
That's
a target
amazing.
of 4 months.
Yeah.
They happened to be starting my products, and I had prepared them already. But I told them to be cautious, and they happened to go to a family wedding, stayed in the hotel, and boy joy. She messaged me back when I was actually in Kenya that happy news that I've fallen pregnant naturally. Okay, but then the whole information had to change, that I had to quickly change and make preparations of one of the most amazing products to let her carry baby to full term. In my heart, I knew that we would manage, but in her soul, she was jittering because she had had these miscarriages. There was that fear factor. We had to remove that fear factor and make her to be happy and a bouncy mom, because a pregnant mom to be, because that fear can really affect the child.
It certainly can.
That child would always be fearful. He would be hiding under chairs and tables. So having removed the fear factor and keeping her under amazing products, and she carried up to 5 months. We had to change up then to things to develop the fetus. Initially was to stop the rejection of the fetus by the chromosomes.
Sure.
And then carrying it from 5 months to a further 4 months full term was another emotional journey. And then a week prior to her delivery, I felt like ringing her up, and about 3 days prior, a week prior, that I must tell her not to go for a natural pregnancy, natural labor. I thought, if the fetus the baby goes through birth trauma, or the cord, or some pressure drops within, or she ends up with some infection inside, it might jeopardize to have a healthy baby. And it just so happened that I didn't want to put the fear in her, but her gynecologist said it's going to be a cesarean. And I said, thank God, her Almighty, you've heard me. But I didn't want her to think like I'm giving her bad luck by saying, please go for the cesarean. Everybody loves a natural birth. Nothing like a natural birth. unless there's complications at labor time. So yes, it was a bouncy, beautiful baby. But when they were in the labor ward, he started saying, Dr. Manjeet, 4 minutes, 3 minutes, 2 minutes, 1 minute, and he went all quiet for 35 minutes. And I'm sitting there, 35 minutes of my life were the longest minutes. And when in between 35 to 40 minutes, he called a message back to say it's a beautiful baby. And there were all my emotions, as if it was me involved, as if it was my children. That journey, I can still sit here and get emotional to say it was such an emotional journey.
That would be.
Yeah, and it was so magical that, you know, it was a beautiful baby, and he was bouncing, and the first thing they did was go to the temple and thank God before they got home.
Perfect.
And doing great and well. So all these parents are great. So these journeys were all so different, and each one is different. So I can never say that each one has to be having the same issues, you know. With her, we couldn't give her some things and even essential fats because that baby would have not stayed. Then I had to, by 6 months, start to develop the brain of the baby. Because those essential fats were important.
Very, very fast.
And then I had to give her some amazing products that she could lactate milk. And she said, it was amazing. And the first thing I said, have you started breastfeeding? She said it was literally 15 seconds after he was cleaned and born that he started suckling and still breastfeeding. So all that preparation, a lot of mothers can't even breastfeed their babies either because, you know, they're very hard on the nipple tissue, or they have not had good products to lactate milk. And then they go into powders and all the other products that are available in market. Nothing like having a natural mother's milk.
For
I don't
sure.
think we need to be shy about this. I mean, for couples who are sitting there and couples who haven't delivered, there's an offline number here that you can call in for advice. Seek advice. It is a journey, you know, some varies from 3 to 6 months, sometimes very rare to 9 months. But even the most, I mean, I've had lawyers, I had pharmacists who couldn't deliver for 8 years of their marriage. And bouncy, then I did tell them not to stop and just carry on, because the progesterone and estrogen levels are in a wonderful balance now, and they weren't even having their regular cycle, monthly cycle. So even to get that in order, that was important. And I said, and one of them replied back, she said, what did she say? Oh no, one is enough. I thought, there you were for 8 years, now in your 9th year of marriage, dying for one. And they followed up. And there was another girl whose husband said, oh no, one is enough. And I said, look, at 21, she had menopaused. All her body clock was now of a 60-year-old lady.
Wow. We
had to reverse that. Imagine, she had hot flushes. She had everything that a woman's shutdown organs had when a woman is fully matured and her body does not have any hormone production of a female. So we had to reverse all that. She had rheumatoid arthritis. She had all the joint pains.
At 21, did you say?
At 21. And yes, and she fell pregnant quite safely with very good products. And that's when I told her, please don't wait. And her husband said, no, one is enough. And I did say, you must not wait. So yes, sometimes not waiting is good. Sometimes waiting is good. I mean, I myself had a 5-year gap, but I really enjoyed that, 5-year gap. And in the process of thinking of having 4, we stopped at 3. Thinking, oh, almighty, that's enough now, because I was also studying and there was too much involvement of having one baby food, one on coming on to pureed food, our own meals, and one on baby milk. And I thought, okay, I think this is enough now. There were so many varied diets I had to balance and challenge through the day. So those...
Sorry, go ahead.
No, go on.
So let's come on to foods, because we always like to end up with foods that can really support a healthy pregnancy. So maybe from conception to a safe pregnancy through to development, and for the child as well. Can you talk to that a little bit?
Obviously, before conception, Felix, good fats. But again, for the mother who had this rarest chromosome, I could not, and I did not allow her any fats prior to that. Folic acid is known to be one of the best ones initially through the pregnancy, but the rest we can't give, because I have my own preparations. I have my own Ayurveda herbs. We have got our own female tonics, and so many herbs that even help male who cannot produce good amount of sperms to have a healthy viscosity in the spermicidal fluid and a major volume of healthy sperms, which is all a story. So going from preconception to conception, it is such a journey. So some people with preconception, obviously they already got fungus on their tongues, they already got vaginal thrush. You need to get rid of that, otherwise the child is going to be born with thrush and they won't be able to suckle. I've had one mother, Felix, who came to me after 4 weeks of the birth, and the baby's tongue was full of thrush. He couldn't even open the mouth. It was like literally a little bit lighter than this white paper on our table. So I had to make sure we worked with thrush, and within 3 days he started drinking. You know, so those are serious issues. Sugar is such a problem with Asian women, or women through pregnancy will make it an excuse to eat anything. You know, there was one thing I did naughty with the elder one, was I craved for a very good homemade dark chocolate ghetto.
Always.
And we used to travel all the way to M4 to the Heston Junction at midnight to crave for a ghetto if I couldn't make it. And with my daughter was fruit. With the younger son was bananas. And it turned out that's what they liked.
Yeah.
It's funny.
Yeah.
So if mothers are on drugs, you know, you're actually making your child go into that. So going on fruits, you know, red fruits are important.
The rainbow every day.
Yeah,
red
all
fruits.
The berries and the cherries, avoiding the strawberries because they are already acid power, the mothers are. Melon and Galia melon and cantaloupe melon, all these are amazing coolants. You need them because when there's too much fire within the womb, even that will not keep the baby intact. The baby can be rejected if the mother has bad fire in the uterus. Yet mothers with fibroids and endometriosis will do fall pregnant in my case, but we do help them. With polycystic ovaries, 100%, it's always worked, touch wood. We've got amazing products, PCOS, that actually make the woman to produce eggs and healthy eggs. Cantaloupe is very good. And obviously, Chinese acupuncture and then cupping is very good for infertility couples. Not for male, but for female. Yeah. Then obviously, ripe bananas are very good, which have a good amount of zinc, which is very important for the immunity of the baby.
Yeah.
There should be, like you said,
so important
yellow skin,
in modern life. Yeah.
Thin skin banana with black dots.
Yeah.
If you're having a yellow skin banana, it's a steady starch. It's not going to do anything. It might just stay in your system. Keeping away from tea and coffee. You know, the biggest problem that Asian mothers or grandmothers think, if you don't have cow's milk, you're not going to produce milk. And they'll keep saying, oh, have milk, oh, have milk. You must have milk.
I've not heard that. But
yeah. And I used to have the same problem. They said, oh, have milk. And I used to take the odd black coffee. That was really like the brewed coffee. They said, oh, your child is going to be very dark in complexion. You're having coffee. So, you know, I was taunted a little bit by saying, oh, your child will have very dark complexion. It didn't turn out to be so. So, you know, we are living in this world of darkness, of not knowing, or our program is only awareness, is it not?
It is. You know, we're trying to shed some really hopeful a bit of awareness. And for sure, look, if you want much more in-depth personal advice, then the number is the place to go. And don't withhold your number. Just leave your number, and one of Manjit or Manjit's team will come back to you.
So obviously emotions must be dealt with, because if the mother through conception and gestation period of the 9 months is on an emotional roller coaster, and there's too much brewing between husband and wife, or daughter and mother-in-law, and mother-in-law or daughter, the whole story can be so different. That child will be born with that trauma.
So important, the whole emotional aspect to it.
Yeah, and you know that women are going through yoga in pregnancy. They produce good, healthy, peaceful babies. Your emotions will actually dictate and be a stamp of how your child will be. You know, so whatever your thoughts are, you think your baby is not hearing, it will gel onto the child. When I was about 6 months pregnant, 7 months, there was massive lightning, so much lightning and thunderstorm that the elder kid was jittering, moving. There was so much movement. It was unbelievable. A kick here and a shove here. And after he was born, he was about a year and a half. We went to a car wash. We had these tokens. We used to buy like so many for £1. Went into the car wash, and he ducked straight away. The wishing and the washing and the crackling. And we said, do you know what? you know, this same movement, it took him about another 2 years to enjoy a car wash. And we said that time when it was raining, from the window, that movement of that child and that car wash, how did he carry that information?
Look, ideally, natural births, you get so much information passed from the mother to the baby. Look, as you say, look, there is a time for intervention and cesareans, but natural birthing is
it's so sad that in Kenya, doctors prefer to 75 mothers having cesarean, because
Really?
it adds a bill, a nice fat bill to the surgeon, a nice fat bill for the gynae, a nice fat bill for the pharmacy, and more as aftercare and scar tissue and nursing and antibiotics. So all these 7 things add up to about maybe having a 1 million shillings minimum added to your bill before you leave the hospital. They prefer that you do a birth during the day and not the night. Yeah,
wow.
So deliver your child during the day and not night. So it is so sad that over 75% of this is encouraged as having a C-section. Yet, you know, the womb is the biggest muscle in a human body. Yes.
It makes sense the moment you say it.
Yeah, it's the biggest muscle, even for most of the heavy, you know, you can say the very big beefy people. And that scar tissue takes so long to heal. So there's nothing like natural birth. You know, people want a birth, a water birth, they want birth at home, but never make those situations. I had a lady who had fertility with me 2 years ago. And I told her that, you know, she was surpassed her 9 months. And I start doing squatting exercises, do some gardening, do some digging. You know, I want you to have a natural birth. And as she was ringing the hospital, having done those things over 4 days, yet they said the placenta is healthy and happy. As she was doing this exercise, she rang the hospital saying, I think I'm ready. They said, no, your timing is not right. She said, I think I'm ready. She just told her husband, just take me, take me. And she said, just drop me here, you park the car. She only went through the double doors and the baby was delivered.
Wow.
Yeah. So, you know, sometimes the mothers need to be heard. You know, it's so magical, this whole journey. That's not the idea. My idea is to say that, you know, the choice that you make, and this infertility or fertility issues or infertile couples, could be a male or a female. There's a lot more in naturopathy and natural remedies. The doors are not shut down. But to go through IVF is injecting drugs and trying to stabilize your hormones and increase your ovulation, and then inject the eggs, fertilize the eggs and put them back in, and then you sign on the dotted line to say if it's not a full fertility, you're only allowed 1 or 2. I've even had couples who have paid 10,500 twice, but with ourselves they've managed to deliver a full-term baby. Yeah, so this is a journey that we only this evening wanted to open up doors for childless couples or couples who've gone through this emotional journey, because it's such a heart-beating.
It is. It's hard to think of things more emotive.
Yeah, those, like I'm saying, those who are aborting freely and those who are yearning that God give us anything. So, you know, I've got a couple of women, I've got, funny enough, I've got 6 couples, but one of them is very senior in the sense that her cycle has stopped, and I told her it's going to take me 1 year to get your cycle even triggered off. So I gave her a broad spectrum, but I think I know the margin in which I can think things will tick off. With the other 5 women, there are so many different issues: morbidly obese, large abdomen, just not falling pregnant, sperm count and fluidity of the spermicidal fluid was too watery, both their alkalinity and acids were not matching. And we work with trying to inject or give them some kind of portions that they need to inject to create that balance, to create a full-term pregnancy. So complex, you know, let's not take life for granted. Let's respect those couples. And for those who are aborting or even abandoning their children,
it's a huge other topic, yes.
Yeah. Pause to think that, you know, there are some couples waiting and praying to have that child. If you have had an illegitimate child, please pass it on. Don't leave them in streets or in gutters in India, you know, or just in the farmland, or here in UK. Some girls have known to abandon their children and never known to be seen again. but pre-matrimonial pregnancy, pre-marriage pregnancy is a big issue. Babies having babies at 13. I mean, Guru Nanak, our first Guru, said this is Kal Yug, a dark period where even a 9-year-old girl will be falling pregnant. We are not too far, where the youngest Chinese couple is 11 and 16.
Wow.
Yeah, in the Guinness Book of Record. Fancy that.
Okay.
You know, some things have to be left for adulthood, isn't it?
For sure, for sure.
Those experiences, there's a
it's
time
good
and
to
a place
live
for
a life.
everything. Yes.
You know, and you know, I feel we're very blessed. My wife and I, we travelled so widely.
Yes, and enjoyed those days.
You know, so much life. And it's like a really good a book where you have different chapters.
Yes.
You know, the next chapter can be amazing, but it's really great that you had a certain chapter, a certain few years together.
Yeah, sure, because that is where how your marriage will be stigmatized, you know, and that will hold. That's the foundation. Those good memories are your foundations, you know. But when you're having pre-matrimonial pregnancies or pregnancies that you don't want, then you're passing the buck around, and that kid is not, he's just not a coin you can toss around. It's a living being. You cannot play with emotions because once this child is unbalanced, for him to become back and accept himself and not to be rejected by one or other or both parents is a serious journey. Because that child, we need so much support in his life or her life. So let's create a happy medium, happy parents, happy household, happiness with food. Rejoice the human life, isn't it?
This is celebration.
It is. You know, 84 ਲੱਖ ਜੂਨਾਂ ਬਾਅਦ ਇਹ ਜੂਨ ਮਿਲਦੀ ਆ, ਐਂਡ ਤੁਸੀਂ ਆਪਣੇ ਬੱਚਿਆਂ ਨੂੰ ਜਾਂ ਧੀਆਂ ਨੂੰ ਜਾਂ ਆਪਣੀਆਂ ਨੌਹਾਂ ਤੋਂ ਜਿਹੜੇ ਕਿ ਉਹਨਾਂ ਨੂੰ ਕਹਿੰਦੇ ਕਿ ਠੁੰਗੇ ਮਾਰ ਕੇ ਕਹਿੰਦੇ ਨੇ ਕਿ ਉਹ ਸਿਰਫ ਕੁੜੀ ਦੇ ਰਹੀ ਹੈ ਤੇ ਮੁੰਡਾ ਨਹੀਂ ਦੇ ਰਹੇ, ਪੌਜ਼ ਟੂ ਥਿੰਕ ਕਿ ਜਿਹੜਾ ਤੁਹਾਡਾ ਪੁੱਤਰ, ਇਟਸ ਦ ਮੇਲ ਜੈਂਡਰ, ਜਿਹਦੇ ਦਾ ਸਪਰਮ ਤੁਹਾਡੇ ਉਹਦੇ ਨਾਲ ਹੀ ਬਖਸ਼ਿਸ਼ ਹੋਏਗੀ ਕਿ ਕੁੜੀ ਹੋਏਗੀ ਜਾਂ ਯੂ نو ਕੰਡੋਨ ਹੋਏਗਾ ਕਿ ਕੁੜੀ ਜਾਂ ਮੁੰਡਾ. ਸੋ ਪਲੀਜ਼ ਡੋਂਟ ਨੌਕ ਆਊਟ ਐਂਡ ਯੂ نو ਡਰਿਲ that information in your daughters or daughter-in-laws that they're good for nothing, because even those things are affecting. This is what has made me do this show, that I was shaken that why in the month of January 5 different numbers, 5 different voices, 5 different reasons for aborting. So if it was from the same place, obviously I would have reprimanded that person. But I also reprimanded that one lady who had 2 girls. And I said, let me tell you, if supposing I send you to a place to see the gender, which I'm not going to, I'll not advise you. If it is a female, what would you do? She laughed. I said, your mockery laugh is enough to tell me what you're going to do. You're now in your 11 weeks and I think you'll be committing a crime. She called for help in thinking I'll really help her, but no, I'm sorry. You know, we need to look at foods, we need to look at this physical being of bringing up your children in good environment, and also babies need to be fed with good milk, isn't it? I don't think we can touch a bit on cow's milk.
You know, breast milk is always going to be preferred, but you know, after that,
the mother's immunity and that lactating milk has got all the things that will help to maximize your kid's immune system. But also looking at formula milks cannot or industry may have made formula milks to mitigate and copy a female lactating milk, but still nothing like nature and natural. And then the natural Indian persona is ke je todi thi te no dudh piyegi te dudh banega. So I'm going to translate that to Felix, that the normal Indian persona is that if the female does not drink milk, she's not going to produce milk. I'm sorry, milk is made through the water. And that the more she drinks, and the fennel seeds or fennel tea and the other herbs that I actually give to get the mother to lactate good milk, you have less bottles to buy. Formula milks are 11, 12 pounds these days. Am I in touch with you? Maybe it's more.
Well, you know, it's the key. If there's a calorie burden for someone to lactate well, and you want that to come from a diverse, wholesome diet, and good supplements are a part of that. To make sure that the nutrient bases are covered from as dense and nutritionally diverse diet as possible.
Exactly. So really, you know, every word Felix is saying and myself, we may be not signaling the right information, but I think we do our best, and this is information only. For your guidance, seek from your information and advice from your gynecologist or your GP. further advice, look at the number down below. Call on that number for off-air advice. On this 9-month journey that a woman goes through, it is such a magical journey. Both partners should be in resonance, should be in a happy mode. And we too, on this very evening, on a happy mode, will take you to another journey of another topic, same time, same place, every Wednesday at 9:40 p.m. and every Wednesday at 7:30 is the Good Food Eating Habits in My Cook Show. Do you want to say goodbye?
Goodbye. Sat Sri Akal.
And Sat Sri Akal.